Hello, I'm Ryu, a breast surgeon at Bucheon St. Mary's Hospital. Breast cancer has several symptoms, but when most patients visit the hospital, usually those patients in cases appear asymptomatic. There are a lot of cases where patients visit the hospital because they found abnormalities in the process of their medical checkups. Other than that, patients would visit the hospital because of the pain they felt in their breast, although in most cases, those pains are actually not related to breast cancer. One of the most common and clear symptoms of breast cancer is when you feel a lump on the breast. If you can feel a lump that wasn't there before, I recommend visiting a hospital for examination. Other symptoms of breast cancer include discharge from the nipple, and the situation can vary depending on the color of the discharge. If it's clear to yellowish, you don't have to worry too much, as there's a high chance it could be galactorrhea instead. However, if it is pinkish from the blood, I recommend you have it examined in more detail. Blood does not necessarily mean cancer, but it is recommended that you undergo a biopsy. Besides that, even though one does not have any early symptoms, if cancer has progressed around the skin, near the lump, the skin may have sunken, or there may be a feeling of pulling in the skin. Also, in special cases for breast cancer, eczema lesions may be another part of the symptoms. Therefore, if the shape of the breast hasn't drastically changed, then it's something you do not need to worry about. But if there is a change in the shape of the breast, or if additional symptoms occur, it's a good suspicion that it may be breast cancer. First of all, it's recommended that you do a self-examination once a month on a regular basis. The examination method itself is not much different from what we specialists do in the hospital. However, the thing that patients sometimes worry about is when they grab their chest, they say that they feel like they can touch something different. It's quite common actually to see dense breast tissue, so it's easy to misunderstand that there's something inside when you grab your breast firmly. So what we recommend is to spread the hand and touching it with the palm, starting from the nipples to the whole part of the breast. Or you can go and start from the top and brush down. By touching around the whole breast, it's important to see if there's any changes from before. And you can also squeeze the nipple to see if there's any breast discharge going on. You might feel the difference when touching, depending on the current position of during the moment you're touching your breast. So, if you're getting confused, you might want to change your position while self-examining. We don't recommend breast examinations for those who are still in their 20s. In the case of these self-examinations that I just mentioned, we recommend doing that one monthly, regardless of age, especially 5 days after menstruation, as that's when a breast swelling is reduced. So we recommend doing a self-exam around that time. For visiting the hospital and getting mammograms, those can be done after the age of 35. But normally, we recommend it after 40. But in the case of a patient with a family history or additional risk factors, they can consider conducting the exam a bit earlier. And if that is the case, they should go visit the hospital and schedule plans after talking to the specialists. Just because we're Bucheon St. Mary's Hospital, that doesn't necessarily mean that we have some other special way of examining. For the breast exam, we conduct a basic screening test such as breast x-rays, mammography, breast ultrasound, and if there's any abnormal findings, we recommend biopsy. In the case of biopsies, it can be conducted on a lump seen on the ultrasound. There's a case of biopsy of the calcifications that's seen on the mammography. There will be a slight difference in the test equipment, but it can be seen as a process to collect tissue and see if the abnormalities seen in the patient's video are cancer or a benign disease that's okay to wait and observe upon. If the biopsy confirms that it is in fact cancer, we will conduct additional tests. If it's cancer, it can spread throughout the body, so we need to conduct a full body checkup with abdominal CT, chest CT, bone scan, and additionally breast MRI to observe and analyze the size of the lesion, which can be helpful for scheduling a surgery. In addition, various tests needed before the surgery, such as blood tests, ECG, and PET, will be performed. Today, we discuss the symptoms that may appear in breast cancer, how to self-examine, and the tests that will be conducted when visiting our hospital for examinations. Thank you.